Hi everyone, my name is Andre Shi. I'm a traditional Chinese medicine practitioner. Today's topic is going to be constipation again. We cover some of the typical types of constipation last time. Today we're going to go into a little bit more details, kind of break it down a little bit more to give you like a more better picture of of what are the types and how also kind of teach you how to differentiate it and then how to um, how to help yourself with a better bowel movement. So last time I mentioned that in TCM, if you have a healthy bowel movement, our standard is that you should have at least once to twice a day, and the best will be in the morning, right after you wake up. And then you shouldn't take too long to pass the bowel, probably like 5-10 minutes maximum. And your stool shouldn't be too hard to pass or too soft. It should be like a sausage shape, and like I said, it shouldn't be too hard to dry. It doesn't look like goat poop, or you should feel completely emptied after you go. You shouldn't feel like you shouldn't have this unfinished feeling after your bowel movement, and it shouldn't take longer than 10 minutes. So if you have if you don't have what I just said, then you probably have some issue with your bowel movement already. So today I'm gonna just break down the few more types of bowel movement. Last time we mentioned heat and cold type. So actually this time I'm gonna teach you a new concept. It's called excess or deficient. So meaning excess meaning too much, like you have too much. Deficient meaning you don't have enough. So when you have too much, the treatment principle is to reduce, to get rid of whatever is too much. And when you don't have enough, when you're deficient, the treatment will try to supplement it to what we call is to tonify, basically just to add what wasn't enough. So the first type is called excess heat. So this type of person would generally have like a stronger body type, stronger build, very kind of like big muscular type of person. And this person will like generally have more higher body temperature, so feels like a furnace when you're around him or her. And they will tend to be more thirsty, and they prefer to drink room temperature or colder or iced water instead of warm or hot water. And they tend to be a lot more thirsty than your average people. They also tend to sweat a bit more. So this type of person, because they have a lot of heat inside, so the water kind of evaporates very quickly. It goes out of their body, so that's why they're constantly thirsty. They need to drink more water. They need to drink ice water to cool down their body temperature. So this type of constipation, if you check the abdomen, you notice the abdomen will feels a bit harder. And when you try to press on the abdomen, this type of person will really hate people applying pressure to their abdomen because it's an excess type. So when it's excess, there's too much already, and you apply more pressure to it, they're gonna have more discomfort. And when this type of person have constipation, couple of days without bowel movement, they will generally have some sort of abdominal pain. due to the bowel stuck inside. Okay, and the second type is called deficient heat, meaning the heat comes from a lack of basically it's lack of fluid. Our body is made of 70% of water. Um, so when you lack of water or body fluid, everything kind of tends to become dry. So your stool can be drier, and then your body can be. You can notice some signs of lacking moisture. You can either be dry skin or dry mouth, dry lips. For this type of person, even though they lack body fluid, but they still don't feel they don't feel like drinking water or anything. Um, and they tend to just sip on the water instead of having a lot of water, like the first type, the excess heat type. And because this is a deficient type of body, so when they have constipation, actually, what they would prefer you apply pressure on their tummy. So, so the first excess type that didn't like pressure, deficiency type they like pressure, and they feel more comfortable when you apply pressure. And when there's constipation, they don't feel they probably don't have much abdominal pain compared to the excess type. The third type is the excess cold type. So, meaning this body has too much cold. So this type of person will generally need to wear more clothing than others, and the hands and feet or the limbs can be cold most of the time. So because they are excess, when you touch their abdomen, they're gonna really hate it. They don't like pressure, and their tummy is a little bit more feels a little bit harder to touch compared to the deficient type. The deficient type will have like overall softer abdomen when you touch it. So the fourth type is the deficient cold type. So meaning their cold is due to lack of the normal body heat. So this type of person, because it's cold, they also they tend to feel cold. They need to wear more clothing. Their hands and feet are cold. And I kind of mentioned this type in the last episode. So this type of person, their stool tend to, their quality is quite normal if you compare it to any other normal healthy person. But they don't have bowel movement every day. They tend to take a little bit longer to produce the same bowel as a healthy person who can produce every day. So meaning their intestine is not moving as fast. It doesn't have enough temperature. So that's why, because if you think for like a healthy person, their bowel is sausage shaped. It's not too hard, not too soft, and they have it every day. And if somebody who doesn't pass the stool, it's normal that your intestine will absorb more water and make it harder, right? But this type of person, the stool is just like a normal person. So that means the water absorption and the movement of the bowel is not as fast as normal as the regular healthy person. So that's one quick way to kind of differentiate it. Whenever a patient comes to me, I always ask about the bowel movement and the quality of the stool. So like so if you have, so think about the stool, right? Okay. Um, so for a healthy person, it's not too hard, not too soft. But if you have more of a heat type of constipation, it's like absorbing more water. The stool will lack moisture, and it will become drier, and it will break into chunks. And if it's more serious, then it's absorbs more water. Its stool is going to be drier, and it's going to become like goat poop. I don't know if you've seen goat poop. It's just basically like round pebbles of poop. So that's kind of one way to tell how serious you are and how much heat actually there is in the body. And there's the fifth type I want to mention. I kind of mentioned it last time. It's called blood stagnation, causing constipation. Blood stagnation meaning the blood flow is kind of stuck. So consider your blood vessel is having a traffic jam. The blood flow is very slow. It's congested somewhere. So because women have menstruation, it's quite common that they have this type of issue, but it also happens in men as well. In men, it tend to be more more of a accumulation in the intestine. It can be polyps, or it can be benign tumors, or some sort of growth that's kind of blocking the normal flow of the stool in your intestine. And so for this type of person, there's a very distinct symptom that they have is they tend to get dry mouth or dry lips, dry throat. Anyway, just dryness around this mouth cavity, but they don't like to drink water. If you ask them to drink water, they'll they want to just sip, or even they just want to rinse their mouth. They don't feel like swallowing the water, which is very interesting. Other symptoms that this blood stagnation body type will have is your skin, especially on your lower legs. It can be very kind of scaly, dry. It can even be flaky. And if it's more serious, you'll have these purplish veins growing out of your legs, and then basically it's like your body is trying to move the blood away from the congestion, so it's growing new veins and it's purplish looking. Or if it's even more severe, you'll get varicose veins, so your vein will be kind of protruding outside of your skin. Also, another way to kind of self-diagnose if you have blood stagnation or not is to check the underside of your tongue. So there are two veins under your tongue. If you go look at the mirrors, you'll see that the veins, they can be thin, or it can be wider, or it can be really light, or it can be very dark. You can even have branches growing out of it. So if it's darker or more branches, or if it's thick, then you probably have some sort of blood stagnation going on in your body. If it's light, it's very thin, it's not really purplish, then you're probably okay with your blood circulation. So in terms of what you can do to help yourself, the best way to do is to massage your your tummy. So here is the picture that I drew. So this is your abdomen, and this is your belly button. Okay, so one hand breadth away on either side of the belly button. So 4 fingers away. There are 2 acupuncture points. They are basically how I diagnose constipation. These are the very important acupuncture points for the large intestine. So what you can do at home is to massage these 2 points. You want to use 3 fingers with 2 hands, so one on top of the other, and you want to press deep into the stomach muscle, and then go in a counterclockwise circular motion to help massage that point. Don't just do like superficial rubbing your skin type of massage. That won't work. So you have to go deeper to kind of pressure the large intestine to kind of manually help it to move. That's one way to help with the constipation. Another way to also that will help is to do a whole abdomen of clockwise massage. Again, with 2 hands, one on the other, and just do like a general circular motion around your belly button and around your whole stomach. So because our large intestine it's actually like that, and the movement of the bowel is actually this way. So when you're massaging, it's going to help pushing the stool to help you with the bowel movement. And another way to do it is also, there's one more way to do it, is use 2 hands to kind of just randomly press into the spot of your random area of your tummy, especially this part around the umbilicus and lower. So this is the large intestine, and this is where the small intestine is. So if you apply some pressure to like random areas, just kind of like massaging, it's gonna help, because our intestine is like a soft type of hose, right? So if you apply pressure to it, it's gonna help move whatever's inside forward, and then once you release it, whatever's back will kind of fill this area. So it's helping your intestine kind of move. These will work if your constipation is not very serious. However, if it's more serious, for example, if you cannot go at least every 2-3 days, or you can only go once every 5 or more days, then this might only help a little bit. You still need to go see an acupuncturist or a TCMP to help you with your bowel movement. Is there any questions? Will the purple veins be gone once the constipation problem is resolved? I have to say probably not, because if there is a purple vein, that means you have the blood circulation blood circulation issue for many years, and it's not easily go away just like that. But there is still a certain percentage of people that can have it disappear, but it's kind of random by chance. It's not always I can say like a guarantee of 50% of people will have that kind of effect. Is it still considered healthy if the bowel movement happens every evening? Well, if I have to grade it out of 100, I will give it like a 90. So if you're 100, then every morning after you wake up, because from 5 to 7 a.m., that's what we Chinese medicine says the time of large intestine. That's the hours when the large intestine is most active. And if you're healthy, you should be able to pass by your bowel around that time. I don't see any questions, so that's it for today. If you like my content, enjoy my life, or if you have any suggestion, please leave a comment, or you can like my Facebook page. I will also upload the live up onto YouTube. You can subscribe my YouTube channel, Andre Shi TCM. It's actually Andre Shi Traditional Chinese Medicine, and my website is ANDRESHIHTCM.com. Well, bye bye. See you next time.